Good afternoon, everybody. Welcome back to Facebook Live here in Oneida, Wisconsin on the Oneida Nation Reservation. It's Monday, June 15th, and today we have our Dr. Veer here for our medical update, as well as we have two people from emergency management. We have Kaylynn Gresham and Rich Figueroa, who are going to give us a lot of information about emergency management during this COVID-19 pandemic and what they've been up to, and give you a lot of insight into that. We also want to just remind you that our Safer at Home order is still in effect. It means we still have to be safe, we still have to be mindful of our environment, and especially our children. We need to keep our children safe. So at this time, I'm going to ask Dr. Veer to begin with our medical update. Dr. Veer?
Thank you, Bobby. Sagoli, greetings everyone. One quick update. COVID testing, as you know, is available through the Woodland Church location. That's a drive-through testing facility right on Airport Drive. Effective this week, our hours will be changing. The testing will be available without an appointment to all Oneida Nation employees and all Oneida Comprehensive Health Division patients. Our time would be 11 a.m. to 3 p.m. You do not need an appointment. You can drive to the facility and get tested for COVID-19. Anyone with symptoms of COVID or anyone that has been exposed to COVID can get tested. I will provide some numbers on what's going on with COVID-19 in our jurisdiction, within the state, nationally, and globally. As you probably heard in the news, the numbers unfortunately are increasing in some states. We have been fortunate in the Oneida Nation. Our numbers have not changed as of Friday. We have 47 COVID-19 cases, 20 in Brown and 27 in Outagamie County. One each in Brown and Outagamie County are under active isolation. We've had those 2 deaths in Outagamie County. In the state of Wisconsin, as of this morning, we have 22,758 COVID-19 cases and 692 deaths from COVID-19 in the state of Wisconsin. Outagamie County at 337 COVID-19 cases with 8 deaths, and Brown County has 2,469 COVID-19 cases with 38 deaths from COVID-19. Within the IHS system, we have 15,241 cases of COVID-19. Bemidji, which is Minnesota, Michigan, and Wisconsin, that region has 292 cases of COVID-19. Albuquerque at 869, Navajo Nation at 7,405 cases of COVID-19, and Phoenix is at 3,364 COVID-19 cases. As you probably heard, there's a lot of increase in those cases, unfortunately, in the Southwest, especially in the Arizona and Texas areas and Florida. In the United States, we're at 2 million cases, 2,094,069 cases with 115,732 deaths. And globally, we're approaching almost 8 million. That's 7,935,698 cases with over 433,000 deaths as of this morning. So unfortunately, those cases continue to go up. As you all know, those precautions that we need to take, we will be taking for quite some time, and those are fairly simple. As Bobby mentioned, keeping safe distance of at least 6 to 10 feet from each other, wearing a face covering or a mask while in public, and washing those hands. I think those simple precautions really will go a long way in maintaining those numbers at a low level. So our community really is doing a very good job, and keep taking those safety measures so we can keep ourselves safe, and more importantly, our family members and our community safe. Face covering in public is really a safety measure for us personally, but it's more importantly a courtesy and a safety consideration for our community members and for society in general. So please use a face covering when you're out in public to keep ourselves safe as a community. I would also now like to introduce Kaylynn Gresham. She's our Emergency Management Director, and she's going to be providing us some updates.
Yes, good afternoon. My name is Kaylynn Gresham. I am the Emergency Management Director for the nation. Bobby invited myself and my counterpart, Rich Figueroa, to answer some questions about emergency management. So I'd like to introduce Rich Figueroa.
Hi, welcome everybody to getting on the call. Hopefully we can take care of some of those question marks that were out there and give you some updates and make you feel a little bit more secure.
Okay, thank you. Some of the things that we wanted you to talk about this afternoon is exactly what is emergency management, what's the scope of work, what's your responsibilities?
So the main thing that emergency management is responsible for is we have what's called an emergency response plan for the nation. Within that plan, it outlines kind of a roadmap of how we address emergency situations, disasters that could potentially affect the nation. It looks at putting in place specific plans to address, like say we have a long-term power outage. Emergency management works to develop the plans and coordinate with all the necessary outside agencies so that we have the ability to stand up shelters. Maybe it's providing feeding, like mass feeding if we need to, just addressing different things within the community and the organization that we can directly address, different things that would entail, whether it's working with the Red Cross or DPW, all those different kinds of things. We put those plans in place and make sure that those plans are cemented, and then we do training. We work with the different employees, different parts of the nation to train everybody to be able to respond when it's necessary.
Can you tell us a little bit about the history of emergency management in Oneida?
Sure. So the Emergency Management Department started in 2006. At that time, many people know Marty Antone was the director. I started there as an intern in 2007 and was at that time the deputy director. The reason that emergency management has a deputy director and not assistant director is because the deputy, which is what Rich is the interim right now, has the authority to act in the absence of the director. An assistant director doesn't have the authority to do that. So that's why emergency management has a deputy director instead of an assistant director. And through that time, we've developed the nation's pre-disaster mitigation plan. What that is a plan that specifically addresses potential emergencies or disasters that the nation could face. Within that plan, we look at fog, we look at tornadoes, we look at floods, we look at droughts, we look at all different kinds of things, and then we put that plan into place. The plan's for 5 years. We work with a consultant to develop that plan. We send that plan to FEMA. FEMA then adopts that plan, and that makes us eligible to request reimbursement for the funds that we spend when we respond to an emergency or disaster. And the nice thing about Oneida Nation's plan is actually that through the approval of the Business Committee, the Oneida Nation Pre-Disaster Mitigation Plan is the template for tribes with FEMA. They've actually used our plan to help other tribes develop their pre-disaster mitigation plan. And we're actually in the process of updating that because that plan's good for 5 years. Our previous plan was good from 2015 to 2020, and as it is now 2020, we are updating that pre-disaster mitigation plan.
Thank you, Kaylynn. I know that emergency management is pretty far-reaching, and I don't think people understand or have an idea of who you deal with. I know there's a lot of agencies, a lot of different levels of federal government, state government, local governments. Can you give us some insight into some of those agencies, some of the different entities that emergency management has to coordinate with, and how it impacts what we're doing here, what they're doing in Green Bay, what they're doing in Madison?
Sure. So at the local level, we're involved with all the jurisdictions. The Oneida Nation, there's 6 jurisdictions within the Oneida Nation. I'm not sure if everybody's aware of that. We have the city of Green Bay, we have the village of Ashwaubenon, we have Hobart, we have Outagamie County and Brown County. So when we do things, we involve all of those different jurisdictions when we do our trainings, because if anything large happens within the Oneida Nation boundaries, we're going to need the assistance, and we need to work with all of those just different jurisdictions. Then we also work with DPW, we work with WPS for power outages and things like that. We work with a lot of different local, state, federal organizations. We work with the EPA, we work with BIA, we work with Department of Instruction, with working with the schools when we work with their plans and things like that. We work with the health center, so Department of Health and Human Services. Then of course we have the federal different agencies that we work with. We work with FEMA and a lot of different, you know, everything and every department that you could potentially think of encompasses something with emergency management, because there's all kinds of different federal regulations that we have to follow, state regulations, you know, local jurisdiction rules, even within our own, you know, own things that we've developed within the nation. You know, we've got ordinances and things like that that affect emergency management. When we have large gatherings like the powwow, they have an emergency action plan that they do. You know, any large gathering that we have, all of those areas. When Rich would do Apple Fest, all those kinds of things, they're all required to work with emergency management to have the necessary plans in place to ensure that we've taken into consideration anything that could potentially happen, and making sure that we have all those connections made, all the dots connected, so that if there needs to be a response, we can do it quickly and effectively.
Thank you. Another questioner is, does emergency management use the ICS system? Is that the Incident Command System?
Correct.
Or the federal version of the ICS, the Incident Command System? Can members use the FEMA site for certification? I'm not
Yes.
quite sure I understand
So-
that question. You might explain the question as well as your answer.
Sure. And so the only incident command system training that I'm aware of is federal. It's not, it's developed by the federal government, it's developed by FEMA, so I'm not exactly sure what the first part of that question means. But yes, you can go on to FEMA.gov. They have a lot of training that you can take, and ICS is one of them. They've got ICS 100 through 400. ICS 100 and 200 are taken, you can take them independent study, but 300 and 400 are generally for the level of the people that would sit in the emergency operations center, people that are directly involved with the response, that have the authority or the decision-making ability to direct different things, like Dr. Veer. The business committee has taken that training. DPW, different areas of the nation that are directly involved with that overarching decision-making of how we do things. They're the ones that would be taking the level 3 and 400 classes, and those are required to do in-person training to receive the certificates for that type of training.
Okay, thank you. Maybe Rich, you can help us answer this question. What is emergency management doing right now in Oneida with the pandemic, with the whole situation? What's been your role? What have you been involved in? Some people know nothing about emergency management, so can you answer that just in a little more detail as to what you're doing?
Well, what I do for emergency management right now is I'm backing up Kaylynn, because I'm the deputy director for the emergency management. So I need to make sure that I'm staying on the calls, I'm staying on all the information, so that in case of Kaylynn not being able to be here for whatever reason, I would be able to step into that role and kind of keep the ship going, I guess. Right now, what I'm doing is I'm doing a lot of logging and filing of protective equipment that we get in from the different agencies and entities. Keeping track of it, making sure I know where it's going, and getting it to the different departments and whatnot within the tribe. So, you know, if anybody out there is thinking about that, is saying, well, I'd like to get some of that, let me know. You know, send me an email. I am on Outlook. So, you know, send me an email, let me know what your need is, and I'm looking at the numbers, not just give me a bunch of masks. So, making sure that we're working cooperatively with the different entities and the agencies that are out there. I know we kind of just throw that term around in rather vaguely, but what we do when we do meet with them is we're updating each other on what they're doing in Brown County and Outagamie County with the state. We're updating each other on what everybody's doing so that we can all have that broad picture of how this is moving through the state. where it's growing, where it's not growing, where are some of the different areas that we need to focus on. And that's where I come in and I help out Kaylynn with. Because right now, if we get like 4 calls at 1 o'clock, she can't take 4 calls at 1 o'clock, so that's where I would step in and I would help her out by taking some of those calls, passing along that information, and then she would pass along the information with me. Coming into it, I'm relatively new to the department. I just came on March 19th. So it gives me kind of a fresh eye looking at some of the emergencies and some of the different plans. So she runs a lot of those things past me just to see where my untainted eye, I guess, would see possible holes in a plan, or possible understanding of the plan coming from an outside, as an outside person. So those are some of the things that I can help out with her.
Okay, you mentioned the plan, and either one of you can answer this, but what is the tribe's plan in the state of emergency for Oneida? Is it something that's written that somebody who wants to help out or contribute? Is it something you can say, hey, can I get a copy of the plan? Is it an ongoing document, kind of a live document that just keeps building and building? Or is there a strategy in place already for well, I guess we didn't really plan on a pandemic, but what kind of strategy was in place for planning?
So we've got the nation's emergency response plan that's updated on an annual basis. The nation does participate in the emergency management performance grant, and what that does is that grant has certain requirements, and one of those requirements is to update. Our plan, because of where we're located, has 16 what they are called as emergency support functions, and each one of those emergency support functions is updated and looked at on an annual basis by all the different departments. Some of them have 2 or 3 different departments that look at them. Some of them have 10 or 12 different signatures that are required on the document. Anywhere from transportation to, we've got communication, we have public safety, we have search and rescue, we have the health center, we've got radiological, because we are located within 50 miles of 2 nuclear power plants. So that's something else that's included in the plan of how would we respond if something happened with that. And yes, it's a living document. It's updated on an annual basis, and anybody that wants a copy of it is welcome to it, with the understanding that there are sections of the plan that are redacted, which means that they're removed or they're blacked out, which are communication numbers, like phone numbers, people's direct home line numbers. Those are not shared with the public, and neither is the location of the emergency operations center. That is also removed, and the reason that is removed is because should there be an emergency or disaster, we don't want people showing up at the emergency operations center. We don't want the media there. We want the ability to be able to coordinate a meeting of the media and then be able to give that information out to the public as it comes through, and making sure that they're getting factual information, and that the information that's shared is concise and just the same with everybody that we're giving the information to.
Thank you. Another issue is that there are 4 phases of emergency planning. Can you elaborate on those 4 phases?
Do you want to sit there?
Yeah. The 4 phases are preparedness, mitigation, response, and recovery. Preparedness is we sit down and we talk about it. We make sure that we all have a sound understanding of what direction we want to go in an emergency, following the proper protocols and procedures. Then mitigation is where we put it into action. Whether we put it into action as far as like different trainings that we can have with different people within the tribe, the different department heads, I guess, so that they can be well versed in whatever the plan is, when we come up with these action plans. The response, the actual event is here, whether it be a tornado, a flood, or the COVID virus. We would respond to it, and we would be in that response mode in different degrees and different levels. And then the recovery, after it's over, how do we start to scoop up and clean up all the pieces, looking at the different costs that went into it, looking at the different personnel that were used, and having everybody debriefed and make sure that everybody's taken care of mentally and physically. And then how do we kind of adjust to the new normal? because Bobby had mentioned several times about the new normal and these masks and things like that, that may be becoming our new normal. So, you know, those are things that we just need to adjust to, and how we can adjust to those normals.
Okay, thanks, Rich. Within those 4 phases, there's a question that says, what are the 16 support functions and who are the points of contact? I don't think we need the points of contact as importantly, because you did mention some of those might change or they may be
Right.
confidential for whatever reasons. But can you talk a little bit about what those support functions are?
So what the support function is and what the role of it is, and so I'll just take, like, say, mass care. So what that support function does is it addresses how would we address mass care if we had some kind of an event. So within that emergency support function, it talks about coordinating with the health center. It talks about coordinating with OPD. It talks about coordinating with the Red Cross, and how would we address in a situation of setting up a shelter to take care of a large number of people. What's required to do that? Okay, so we need to be able to feed those people. We need to be able to shelter those people. There's certain things that we need to be able to provide when we're addressing that specific that specific area of what happens when there's an emergency or disaster. So there's another one, there's firefighting. So it lists all the different organizations, because we don't directly have our own fire department. It talks about who the contacts are and how we leave that line of authority to the areas that have that expertise, whether it's the volunteer firefighters in the town of Oneida, or whether it's something that would happen within the boundaries of Green Bay, then it would be the Green Bay Fire Department. And it just kind of addresses how those areas are responsible and what they do in their lines of work, and how we address the different things to support an emergency.
Okay. I think some of the people who are sending us questions have a little bit more information and are a little bit more knowledgeable about emergency management. So some of the questions, if you could just interpret what some of the acronyms are, and
Sure.
you've been doing that, but one of the questions is there an individual IAP for the pandemic now?
Yes, an IAP is an incident action plan. And the incident action plan, it outlines numerous different things. And yes, the main incident action plan that we have is updated daily. In the beginning, it was updated sometimes twice a day. Now they're moving to that incident action plan. They're going and they're doing it at a 2-day pace, because the response right now is not as critical or as in-depth as it was before. So the incident action plan, what that does is it identifies the different things that all the different areas are doing, the way that they're responding, and who's responsible for the different areas of response. That's what the incident action plan does.
Okay, there was a question about enrollments, and we don't have anybody from enrollments here, but you can call 800-571-9902, or just email enrollments@oneidanation.org. So sorry we didn't have enrollment staff on here. Another question is emergency management just for the tribe as a whole, or can emergency management help individuals?
Emergency management looks at things at a bigger scale level. It depends on what they're asking for help with. Generally, emergency management can steer you in the direction that you need if you need individual help, but generally it's at a bigger, a larger scale is what emergency management addresses.
Okay. One of the other questions, I think I missed it. Are there MOUs with other adjoining jurisdictions that supply equipment? Do we share? Do we have some sort of a network in which we work with the other jurisdictions that surround us for supplies, for ordering? Any kind of MOU that exists?
No, generally not. Not for supplies and things like that. I mean, we work with Brown County and Outagamie County through the pandemic. We've coordinated with them as far as for getting the PPE, which is the personal protective equipment. We've coordinated with them for things like that. But as far as like equipment, the equipment that's used to respond is owned by the nation unless we ask them to come in and assist us. And there are MOUs and MOAs with surrounding jurisdictions. Emergency management is part of EMAC, which is the Emergency Management Assistance Compact. So we're divided into regions within the state, and we are in the East Central region. And so we've signed an agreement saying that anybody that's within that region, if we need assistance, that they will come and help us for a certain amount of time at no cost to us when we look at responding to emergencies and disasters and things like that.
Okay, thanks. One of the things that we have in common with some of the other areas of the state is the tribal jurisdiction, the tribal set of how our governments work. Do other tribes in the state of Wisconsin have emergency management departments, directors? And do we coordinate with them? Is there any kind of a Native American national network of emergency management directors that probably address things that may happen differently in terms of process and laws on a reservation than would normally happen off?
Yep, so there's actually, it's called WITEMA, which is the Wisconsin Tribal Emergency Management Alliance. All of the tribes in the state of Wisconsin that have an emergency management department are part of that alliance. There's several areas or several tribes that now have emergency management departments that may not have had or have had somebody wear that hat of an emergency manager that may have not had that before the pandemic started. But as far as I'm aware, all 11 tribes have that now. And yes, there are several different organizations within the United States. Oneida actually sponsored the National Tribal Emergency Management Conference here in August of last year. So we had, I don't remember exactly the number of tribes, I believe it was close to 125 different tribes that attended, people from Alaska, all over the place. We had several different people attend that conference. It was for a week, and it was at the Radisson this last August.
Okay, now I'm not sure who can answer this question, but what does the new normals entail? I hear that phrase a lot, but I'm not sure how it looks specifically for tribal operations. Can we talk about specific examples at another session, or is that something the BC is discussing? I'm sorry.
Well,
the new normal.
I think I'd let Dr. Veer speak to some of that. I know there's a few discussions going on right now of what were the kind of precautions that we want to put in place for our employees and our customers and clients and things like that. There's not been any formal adoption of anything right now, but there is discussion, and I think Dr. Veer is more suited to answer that question.
Well, the public health emergency declaration was extended through July 12th, and there are processes and protocols that we're following that if you had asked us 6 months ago, we never really had any such specific plans or ideas of implementing any of these procedures. So we are in the new normal today, and will be for the foreseeable future. The challenge, I think, for us as humans is how do you really address a change in terms of a discrete date. We're all looking for some firm and clear information on what happens, say, on July 12th, when the public health emergency declaration expires. Well, in this situation, if it does not get extended, I wish we had the power to predict what's going to happen in July, or we had the power to negate the pandemic by a declaration. We don't. So the recommendations we really have for the near future, which may be months from now or longer, is to keep those safety precautions in place. The protocols that we have in place within our facilities are evolving based on science. As we learn more, we make some of those recommendations and adopt them. The challenge we face currently within our state and nationally is a lot of our community members nationally, our citizens are not following some of those recommendations. The universal masking recommendation was provided by CDC in April, and it's a recommendation that unfortunately is not being followed as universally as it would, if it probably was, we would not be seeing as many cases. So that's our normal as we speak today, and it's new. We've never dealt with a situation like this where we were having to distance ourselves and use face covering. So this is new for each one of us, and having put those protocols in place, we keep reminding each other and ourselves to follow those precautions, because that's really not our inherent nature to do that. In terms of making a prediction when things are going to be back to a new normal, I don't know that, and I would not venture a guess at this point.
All right, thank you, Dr. Veer. I think we've said it before and we'll say it again, is that this COVID-19 pandemic is worldwide. We live in our small community and we think the world revolves around us sometimes, but there are no answers, no hard, finite answers to when things will change, what will the new normal. We're all learning, and this entire world is learning how to change their lives. It was the end of an era. There's no more, walking and being free and going wherever you want, however you want. Every time you walk outside of your home and you encounter somebody, if you're not masked, if you're not sanitizing, if you're not keeping your distance, you're leaving yourself open to the dangers. So until, we get a vaccine and, make those kinds of changes, we're not sure what the future is going to look like, when it's going to end, or what the new normal is. Just as Dr. Veer says, right now, this is worldwide, this is the new normal. And there are states, there are countries that have reopened, and they've let their guard down, and now they're pushed back into a position where they have to close certain businesses again, because they found out that it's not gone, it's not going away. So we continue to encourage you to stay safe, to practice the social distancing. We can't say it over and over enough. We have a heat wave coming, which is something some of us look forward to, but it can be troublesome for others. And I wanted to ask Dr. Veer if perhaps he can talk about Tuesday and Wednesday, when we get into the 80s and to the 90s, some things that we can do safer to check on our elders, check on those who are vulnerable, and some of the things that we need to do in this heat wave that's a little different than what we've done in the past. We're not going to have the massive cooling shelters that we've had in the past. So Dr. Veer, I caught you off guard on that.
Sorry. I think the precautions really, especially for some of our individual community members that have health issues, lung problems, heart issues, is to really be mindful of when it's warm outside and humid, stay indoors, stay in air conditioning, and if you are trying to exercise, do that in the early morning hours or evening when it cools off a little bit. Stay hydrated, make sure you get enough fluids, and check on your elders, on people with health conditions. Avoid crowds as much as you can. When it's really warm and humid, it's even more challenging to put a face covering on, so try to stay home and stay safe. Make sure you're hydrating yourself, and usually water is the best fluid that we recommend. Avoid too much caffeine. Soda that has caffeine is usually not a good product to use for hydration, and obviously avoid alcohol, which can make people dehydrated. So stay hydrated, stay home, and check on your elders.
Thank you, Dr. Veer. So in closing, I do want to remind everybody that this week we have the first farmers market back in operation this year, and it's a drive-up approach. So we have posters on our website. Take a look at that. We also have the final week of the Oneida Feeding America distribution at the food distribution. That's Friday from 10 till noon. Drive up, stay in your car, and receive a box of fresh groceries. The school lunch program continues at the Norbert Hill Center. They've just identified one site. They were feeding over 500 people. 500 of our young people every day are students. So again, that's just at the Norbert Hill Center. let's see. I think last week I mentioned that today they're beginning to take applications for a small business grant. The Wisconsin Economic Development Corporation, the WEDC, starting today until next Tuesday, are accepting grants. They're going to give 30,000 grants in the state of Wisconsin of $2,500 to small businesses. And that website is wedc.org/ capital W, capital A, capital I / small dash business dash grant. So those of you, if you know somebody in small business or you have a small business, check out that website, and we hope that you're included in one of those 30,000 grants that are going out. Applications are only for about a week here. The last thing I have is community cleanup. The flyer says, please join us in helping our neighborhood stay clean and beautiful in honor of our Rites of Passage program and our young leaders. They'll be cleaning at the Green Earth Trailer Court, Falling Leaf Site 2, and Tall Feather Way tomorrow at 5 p.m. They would like you to meet at the Cliff Webster Building on County H for cleanup, and a cookout will be provided. Please remember not to gather in groups of more than 10 to 20. Keep your social distance. They will provide the gloves. Wear your masks. Sanitize before, sanitize after, sanitize during. Keep your social distance and help clean up the community. If you have any questions, you can contact through email jwilson at oneidanation.org. And as always, we ask you to remember us in your prayers, pray for the community, to be good to one another, and to remember to live in harmony with all that's around us. Yawonko.